Can I say we have two people who have indicated they wish to speak. I would like to get both in, but to do so, each of you needs to speak for no more than 4.5 minutes. Thank you. Ronnie Cowan.
Thank you very much, Mr Gates. I was hoping to get much longer on my feet, and I'm sure you'll understand that. But a lot of what I was going to say has been eloquently covered by the Honourable Member for Norfolk and Reigate, so I shall skip over those particular parts of my speech. The important fact here is there is no financial cost that can be attributed to drug addiction that comes close to matching the human cost. The death of a loved one, the suffering of an addict, the wasted lives and the associated suffering far outweigh any amount of money that has been spent fighting the war on drugs. And yet we continue to pour time, effort and money into a system that emphasises criminal prosecution. Since Mexico intensified its approach to drug law reform, over 100,000 people have died and 20,000 are missing. And the personal testimonies from members of anyone's child are heartfelt and painful. Anyone's child is calling on government to regulate drugs to reduce the risk they pose. Legal regulation doesn't mean a free-for-all where drugs are widely available. Our current laws have already achieved that. We need to take control away from the criminal fraternity. Across the world for over 50 years, the war on drugs has killed the innocent and made the guilty rich. It has destroyed communities and compounded the difficulties faced in addressing addiction problems. As we know, the UK Government spends £1.6 billion a year on drug law enforcement, and as was pointed out early on, even the Government know that their drug policy has failed. Last night I attended an event hosted by Adaction, and a gentleman who is in recovery said, "As humans we judge, it keeps us safe. Before you judge, try to see the person." So what can the Government do? Safer drug consumption rooms we've talked about are already saving lives in 8 European countries, as well as in Canada and Australia. They've been endorsed by the British Medical Association. These facilities reduce the spread of infectious diseases, HIV, Hep C, and the risks of public drug use. No one has ever died of an overdose in a DCR anywhere in the world. It's the third time we've heard that this afternoon. You will hear that again. Heroin-assisted treatment is also being successfully implemented in several European countries and is endorsed by the British Medical Association. In 2016, the Advisory Council on the Misuse of Drugs stated that central government funding should be provided to support heroin-assisted treatment for patients for whom other forms of opioid substitution treatment have not been effective. And I think we agree on that point, but the Government has failed to act on this request. Specialist drug checking services can allow people at nightclubs and festivals to find out what's in their batch. Data from recent UK trials showed that 1 in 5 people found that they did not have the drug that they expected, and 80% of this group then chose to use a smaller quantity, avoid mixing with other substances, or dispose of their batch altogether. But if it's a financial justification that is required, rather than a humanitarian one, researchers in the US Office of National Drug Policy confirm what you've already said about the expenditure on health being more than paid for elsewhere. They estimate $1 that is spent on abuse treatment saves $4 in healthcare and $7 in law enforcement costs. Drug abuse treatment not only saves lives, it saves billions of dollars as well. While drug use continues across society, we must note that addiction can and does affect people from all walks of life. Only 10% of drug users will develop an addiction. And addiction does not respect race, creed, colour, religion, gender or financial standing. But as is often the case, it is the poorest that suffer the most. In 2008, the Scottish Government published the National Drug Strategy for Scotland, The Road to Recovery. This set out a new strategic direction for tackling problem drug use based on treatment services promoting recovery. The Scottish Government has invested £689 million to tackle problem drug and alcohol use since 2008. Education has been important as part of that strategy. And there, certainly.
For giving way. Drug-related deaths are a particular problem in Scotland, as you have outlined, and including my constituency of Angus, where it's rapidly increasing at actually a faster rate than England and Wales. Would the honourable member agree that the Scottish Government needs to get serious about addressing problems in NHS Scotland, such as the staff shortages in Angus and the problems facing Police Scotland?
Speech.
Intervention, not a speech. And so I'd be grateful if the honourable member would respond to it very briefly.
I've covered that point right now. Public Health Minister Aileen Campbell has announced a refresh of Scotland's drug strategy. We will not be complacent with what we've achieved, and we will continue to take evidence-based approach and improve what we're doing in Scotland. We've been working a Seek, Keep and Treat framework. This joint initiative between the Scottish Government and the Scottish Drugs Forum will examine the operational implications of engaging with older drug users, how to encourage them into services and how to keep them in treatment. And while many classify drugs as heroin, cocaine or cannabis, we must not ignore alcohol. Alcohol addiction is one of the most damaging forms of drug addiction. Absolutely. 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 In conclusion, Mr Gapes, spending money to address addiction problems as a health issue will not only bring about better results, it will prove to be less expensive than our current strategy that criminalises and stigmatises people with addiction problems.
For managing to squeeze me in for this.